Today, we're going to start changing the world as long as the weather cooperates. So I'm packing up today because I'm going to have a meeting with one of my advisors on my patient-reported outcomes project. This is a tool I'm interested in because it helps patients and physicians visualize the impact that certain treatments may have on the patient's health. It's also really important because it is based on a patient's own input, so it's really listening to the patient's sense of what's going on. Here, let me show you how important it is in this diagram. We often judge the success of a treatment with three parts. Especially when it comes to a surgery, we want to make sure we have a technical success, that the procedure itself went according to plan. We also want to minimize side effects, like disruption of the surgical site or infections, things of that nature. Especially with orthopedics, we have to measure function, and we started off doing that by looking at things like strength and range of motion. After you worked on the body area, did it regain some of the strength and range of motion that you were hoping to regain? But even more practical than that is something called patient-reported outcomes. This is a truer measure of function. It's all about, did the individual get back what they lost in their daily function, their resolution of pain, their sense of well-being. That's where I think the magic is. By using a patient's own reported outcomes, physicians can create more tailored treatment plans and better communicate how those treatments will impact their life on a daily basis. So I'm excited for this meeting. I'm getting ready, get packed up to meet with my advisor, and hopefully some of the snow that's starting to fall won't impact my travel too much. This small amount of snow just shut down the schools in Nashville, the highways are a mess. Our nanny won't even be able to come in. I'm hoping I can turn all of my meetings into conference calls. All right, let's get to it. Okay, well, back on a serious note, I am very excited about being able to work on this patient-reported outcomes tool. I think the biggest impact is going to be on developing tools that address symptoms, psychological well-being, and measuring the impact of our treatments on financial well-being. Those are the three things I think are important. If you think there are other areas that doctors need to focus on to better serve patients, please let me know by putting it in the comments below. And if you think there's a way I should prioritize those three that I'm already talking about, symptoms, psychological well-being, and financial well-being, let me know what order you think is most important. I need to start with the tool that has the biggest impact first. Great. Thanks again for watching, and thanks for all your support.